Assalamu alaikum. My name is Marya Zulfiqar and I'm from Ziauddin Dental College. Today we will be shedding light on a topic that is so often neglected, the unspoken stigma of dental care and receiving it. When I enrolled into dental school, a lot of people came up to me and said, "Why would you choose this profession? A lot of disgusting teeth will come to you all the time. They smell bad and they're covered in naswar." I don't think any other medical professional is asked this question. This is why people are so scared of visiting the dentist because they fear being judged. I myself brush my teeth 2 times before I visit my own dentist. So let's explore this through this presentation. Generally speaking, oral health has an association with hygiene, which means that people who need this help are perceived as unclean, disgusting, sloppy, and lazy. In Pakistan, there's also socioeconomic and cultural gaps, which add to the narrative that oral health is just not important or urgent and expensive. And that, coupled with the anxiety of actually visiting the dentist, it just sounds like a very uncomfortable experience, and nobody wants to inflict that upon themselves. This brings me to just brush better. We've all heard this, and it's extremely counterproductive because it helps nobody. As we know, oral health is multifactorial. So many things play into it, such as inadequate exposure to cleaning methods due to your socioeconomic position, or not the inability to take care of yourself due to conditions such as depression, then addiction to smoking, genetic susceptibility to certain conditions such as bad breath, and even systemic health problems contribute to it. There's so many more. But brushing is not the end all solution. A dentist can only take care of patients that expresses their needs. That's why community encouragement is so important. But in the dental clinic, a dentist can create a comfortable enough environment for the patient to not only express their needs fully, but also receive treatment for their ailments. In the research reports I read, a lot of patients came forward and said that they did not like that the dentist was giving them judgmental, disgusted looks, and their tonality of voice wasn't quite right. And these subtle nuances would often go unnoticed because they're not on purpose. But that's why we need to be more aware, and we need to show more empathy than you would generally, because these are caught on by the patient because they're in such a vulnerable position. They already feel inferior and insecure. You need to make them feel like they're safe in your space and you will take care of them. If we are not able to get rid of this hostility, a lot of patients might feel like they need to conceal information from you because they don't feel safe with you anymore. So, this not only predisposes the patient to additional risks, but also the dentist, especially in contagious conditions where more safety precautions need to be taken or when anesthesia or medications need to be managed per case. It just creates a lot more complications. And the anxiety and the negativity from this experience will carry on to the next. People will avoid going to the dentist, and manageable conditions turn into something that's a lot more trickier to treat. As you can see, the conditions most stigmatized in society are most likely very manageable. So instead of discouraging it and making it harder to receive help for people, we should lean more towards rehabilitation. People say eyes are the windows to the soul. I disagree. I think it's the mouth. That's why I chose this profession, because your mouth sustains you, doesn't it? You eat with it, you smile with it, you talk with it, you breathe with it, even though you shouldn't, but you do. And that's why so much of your self perception and self esteem resides in its condition. So, disease not only gives you physical pain, but also social withdrawal, facial dysmorphia. It strains your relationships. It might even stop you from getting job offers. You can't even recognize yourself in the mirror or smile in pictures. So instead of social rejection, which only leads to isolation, how about we treat people and bring them back to their most confident self? So, how do we get there? Education and awareness. Dental care professionals of all should be sufficiently trained in managing stigma during dental education. There should be more advocacy for workshops and guidelines, and oral health problems need to be demystified in society to garner community support. Social empathy and support is so important. It's the very core, because rejection leads to further demotivating people from asking for help and being more delusional about their problems. They stop viewing it as urgent or important. All of these problems are manageable if we can gather more trust from people and we can make it a more comfortable experience. These are the researches I read to get a more qualitative understanding of the topic and also gauge more insight, because some of these feature patient accounts, which really helps you step into their shoes and understand how they're feeling and how to better approach it. You can find all of these on Google Scholar. Thank you so much for your time and interest. I have been waiting for an opportunity to discuss this on a platform such as this, and I'm very grateful to have gotten it. Thank you again.